Today we will be reviewing coronary artery angioplasty, which is also known as percutaneous coronary intervention. This procedure is done on special blood vessels in your heart, called coronary arteries, which provide oxygen to your heart muscle. Plaque can significantly narrow blood vessels, which will decrease the amount of oxygen that will get to the heart. The main goal of this procedure is to make sure blood flows properly through these vessels. Here's how it works. First, the doctor numbs the skin on your wrist, then puts a tiny needle through your skin into a blood vessel called the radial artery. After that, they carefully slide a thin, flexible wire through the needle into the artery. This wire goes all the way to your heart. Now they use a small tube called a sheath to get inside the artery. Patients report feeling some pressure, but not feeling it move around inside. The wire is guided all the way up to your heart. Then, a flexible tube, which we call a catheter, goes through your coronary arteries. The doctor watches everything on a special screen. Using a fluoroscope, once they're in the right spot, the doctor takes out the wire. The tip of the catheter is put into the coronary artery they want to check. To see things better, they use a special dye, which makes any blockages in the artery stand out. If they find a blockage, they put another wire in and move a balloon to that spot. When the balloon gets inflated, it widens the artery, making blood flow better. The balloon is used to expand so that the stent could be placed. Here you can see the balloon expanding, which would allow for better blood flow. When the stent is in the right place, it expands and stays put. The balloon catheter is taken out. Once it's taken out, the vessel is reopened, and this allows the surgeon to place the stent. This is how the stent looks. Usually these allow for the vessel to reopen and provide blood to the body. There are two types of stents, normal stents and drug-eluting stents. At this time, the surgeon should already know which type of stent the patient will receive. The stent is then placed in the arteries through the wire. Once the surgeon determines that the stent is in the correct place, they can slowly remove the wire. In doing so, the surgeon is able to remove the wire while keeping the stent in, and that's how a coronary artery angioplasty is performed. Thank you for watching. Please make sure to like and subscribe.